Out here in the Atlantic Ocean is an island called Cap Cameroon, one of the 5 health areas of the Manoka Health District area under the Douala 6 Council. No one here has the luxury of denying the existence of social challenges that beset the socio-economic well-being and makes them vulnerable to epidemic sicknesses.
The health situation has been so deplorable. We are living in an island where to transport patients from here to Douala, if there are serious cases, from here to Douala or from here to Tico, has not been easy. We have vaccination issues. We have issues whereby the people, even the population, when they talk of vaccination, they were running away.
In Cap Cameroon, access to primary healthcare is a real struggle as the island is very far from the big cities, about 45 minutes from Yopwe in Douala by boat. Another issue is the problem of cleanliness, with floods experienced daily full of metabolic waste that contaminates children who find pleasure in swimming in the water.
It's a bit challenging for us here because the environment and the water, everything, but we are managing because we are just trying. We have problem to have good potable water to drink. From the time when I was pregnant, it was a bit difficult because it came one time when I really had some complications. So there are some certain things I really needed to some doctors that are qualified to attend to us. But since there was not, I have to rush up to town like Tico to really have some good medical attention there. So all those kind of things, they are really challenging for us.
Behind me is 2 toilets where patients admitted here at the Lone Health Center in Cap Cameroon, renovated by Chai, will have to make use of. This makeshift health center has about 8 rooms and a pharmacy that will ease the burden of many under the Manoka Health District area when it comes to access to basic health care.
This is the Cap Health Center created in 2020, but it's in 2023, February 2023, that the ministry sent me here as the chief health center. As person that we have, as nurse, I'm the only one that is recognized by the minister. But I took 2 other ones with whom I'm going to work, and that I will try with the income of the center to pay their salary.
The number of maternal and child deaths plus zero-dose children has dropped thanks to a rapid intervention by community health workers supported by the Clinton Health Access Initiative.
When we just came here, the people were so naive. When you talk about vaccine, they look at it very far. They know that it's witchcraft, that the government have come with something to come and poison them. But when I entered their houses and started sensitizing them, house to house, and meet them, have meetings with them, I tell them about vaccine, what is good, what the importance of vaccine. Prevention is better than cure. I say they taught people in school. People here, you have the facility because we come in town, we pay taxes to go and take vaccine in the hospital. But here we meet you people with the vaccines in the house. So who is of the advantage? They say it's them. I say, okay, you take your vaccines.
At the start of this program with Chai, we had to do internship at New Bell District Hospital, where we were trained on proper vaccination. We were trained on how to follow up women during antenatal clinic, that's ANC. So we were there for 2 weeks. We came back, it was not easy. We decided to start a door-to-door vaccination, and we faced some difficulties because of the high tide. During high tide, it's not always easy, but we always make our effort.
The community plays host to a population of about 5,000, with 70% of the inhabitants coming from neighboring countries like Nigeria, a locality in dire need of government support.
The eye of the government, which has always been there for a village like this, which have many health challenges because of this natural position that we are finding ourselves to transport maybe patients from here to Douala or Tico, that the newly created health center, integrated health center, should really be built and health personnel transferred, equipment well equipped will help us health-wise.
We also need health facilitators who can go down to the field to sensitize all the populations, especially here in Cap Cameroon, which we constantly have the erosion, as you can see. Now the water level is high and it passes like this with so many diseases and sicknesses. We are spending time to tell them that this water is not as good as the sea. It is a little bit dangerous. We also need these health facilitators to back us up in such campaigns.
Cap Cameroon is not the only community with limited access to basic health care. There are many other remote areas with different realities. As the country rolls out its universal health coverage, it is a moral obligation for health actors and policymakers to consider such communities when designing health programs in order not to compromise the principle of health justice and equity.